Welcome back to another episode of The Aesthetic Angle presented by Monarch Plastic Surgery. I'm Dr. Joe Spaniol, and I'm joined today by Ashley Burdolski, one of our estheticians, and Rachel Lawson, one of our nurse injectors. Today we'll be covering men and the topic of skincare, injectables, and plastic surgery. It's not often a topic that is brought up, but it's definitely worth covering because there's a lot of, subtle things that are changing that men are finding more approachable within our respective fields, and we're excited to talk about it. Just to review, so the American Society of Plastic Surgeons puts out some statistics every year reviewing all things plastic surgery related under the sun, and every year, men do make small gains as far as what they're seeking. For instance, of all plastic surgery procedures, men only made up 7% of procedures in 2024, but that was up from 6% the year prior and up from 4% the year prior than that. Some of it is we're still sort of seeing some residual waves from COVID. Many men sought more procedures during COVID. A lot of it was looking at themselves on Zoom and for meetings. I know I certainly saw that when I was in training. I don't know about you guys. And I think some of that momentum has continued to build, and I think it's becoming less taboo. I like talking about what I've had done with other guys. I enjoy looking more youthful and refreshed, and I don't think there's anything wrong with that and about talking about that. So anyway, I'm excited to be here today, and I've kind of said enough. So we'll get on with it. So we'll start with some skincare stuff. What?
I said, here we go.
So, Ashley, what are some common things that you see male clients see you for that they're looking for help with?
I would say a lot of guys, dark spots, broken capillaries, enlarged pores, blackheads, things like that. Things that more so have popped up maybe recently, or things that they've even seen their whole life that they're like, maybe somebody can fix this. So, yeah, that's what I'd say. Are
they coming in on their own volition, or are they being nudged by a partner?
50-50.
Okay.
I'd say a lot of our patients are husbands of our patients, whereas some guys are I've seen this, I wanna try it out myself. So yeah.
Nice.
The street. Yep.
Nice. That's great. And how do you sort of navigate when they're coming in on their own versus if they're directed, or does it really even matter?
Honestly, it doesn't matter because it's always going to be case by case.
Yeah.
Obviously, when you have a wife saying you really need to get those brown spots taken care of, we're going to go one direction with them. Even though I may see a few other things, we're going to go probably after what the wife said.
Are there any things that are more common in men than women when they come in to see you?
I mean, not really.
Okay.
I
would guess that men are just worse at taking care of their skin.
They are. So sometimes you have to address the basics, wear your sunscreen when you leave here, wash your face tonight. There's different things that you don't typically have to tell a woman, but you do have to tell a man, or you have to tell a teenager. There's just different variances in that.
Do men get bigger blackheads?
I mean, I'd like to say yeah.
Yeah. Are they more gratifying?
I like to pick men's blackheads more so because they're more, gratifying. Yes. Yeah.
That's funny. Yeah. So you've passed the esthetician test.
Oh yeah, that was my favorite part. I love that. It's the more the merrier.
Yeah. I said on another episode, but if they had the high school test where it's figures out what career, it's do you like popping blackheads? If the answer is yes, that's it. That's the end of the test.
I would have been here.
I would have for you.
I wouldn't have to have gone through 4 years of college. I would have just ended up here.
Are there any differences in how you treat similar conditions between men and women?
No, because it's always going to be a skin-to-skin scenario. So men versus women, we're still looking at the main concern, or whatever their concern is, that's what we're wanting to treat. So it's going to be based off of your skin type or off of your concern. It's just not, men get to do this and women can't, or vice versa. It's all just from skin to skin. Okay. Whatever your skin type is.
Sure. Do you feel like it's seasonal with men compared to women? I mean, women sort of know that winter is sort of laser time.
Right.
Men, I feel like don't.
They don't.
Much appreciate that.
Yeah. So I wouldn't say it's seasonal, but it has to be seasonal if you
Yeah.
look at the big picture.
Okay.
We do have to look at lifestyles and things like that.
Right.
Men may want to come in and say, "Hey, I'd like to have this halo today, but I'm going skiing next week." Like, I know it's winter, but you can't. Or, they have a big golf tournament, or
Yeah.
just got their kids' baseball tournament that weekend. Like,
Sure.
we need to be cognizant of those factors leading into a treatment as well as after a treatment.
Yeah.
Yeah.
Makes sense. Are there any like great sort of workhorse therapies for men?
No,
Okay.
no.
So, because you've got chemical peels, microneedling, lasers.
I feel like every man that comes in, like, they could do just about anything. But as far as like a treatment that's directly catered to a man,
Okay.
no.
Okay.
I don't know if I answered that question correctly.
No, I think so. Yeah. I mean, you have a lot of tools in your toolbox, and you
Yeah.
could use any of them on whatever walks in the door,
Right.
depending on what they ask for, male or female.
Right. So, like, somebody who has large pores, a man, we may just do a profractional on them.
Okay.
But things that we have to be cognizant of as well are you on blood thinners? Have you just been out in the sun? Are you about to go out in the sun?
Okay.
But men, we have to worry more about how they're feeling. Are they comfortable? Women, I don't really worry about as
Because
much
they're tough.
because I know we're tough. Yeah, you guys on the other hand,
They'll
sorry.
also let you know.
Yeah, they'll tell you.
Yeah.
They whine more.
They
Well,
do.
yeah, I think a guy would be more inclined to hide this is not comfortable because you're supposed to be tough.
And then you're
And they
doing
shouldn't be, but
something.
I do think that's probably the case.
Yeah.
That women hide their discomfort.
No,
more?
they tell you. This does not
Oh,
feel good.
oh, oh.
Where like the
Men
man
will show
isn't
trauma
as
stuff. Yeah.
open to say.
But I'm more weary, and I don't think weary is the right word. Treating a man, I'm like, oh, this is probably gonna hurt him more than the woman. And I know that sounds horrible to say, but they're not used to this kind of pain. Like, let's go for the pain right now. Whereas a woman's more used to it. She's had BBL, she's had things that aren't super comfortable. But a man comes in, I'm like, all right, this is gonna hurt a little bit. Are you ready
Yeah.
for
I
it?
could see that.
Yeah.
I'll attest to that. My
Yeah.
wife and I both had a profractional like a week apart
Right.
because Sharina had started here and she
Yeah.
needed to train on it. So
Yeah.
it's like, sure.
Sign me up.
Sarah just had a conversation the whole time, may have taken a nap, I don't know. But I was like, whew, that was spicy.
Yeah. Yeah.
And I knew I was a wuss.
Yeah.
But then it was like, objectively, you're a wuss.
Yeah. Ding ding ding.
She would it was fine.
And we've got really good numbing cream and stuff too.
Oh yeah, it's great. But I do worry when they come in, like, I'm like, it is gonna hurt. Just, your wife didn't tell me to go super hard. This is just what you need. Like, sorry.
I love it. So, can you briefly review, because you mentioned profractional, and that's I did as well. Can you review what that laser can accomplish
Yeah.
for our listeners?
A nice way to just simplify it is it's like aerating the lawn. So it's going to make these tiny little holes, if you will, that are going to induce collagen production. Because when an injury happens to the skin, your body's natural reaction is, oh no, I need to go there, I need to heal. Well, you're going to get collagen in that area. You're going to get all the benefits of anti-aging happening in that site, right? It's not a very long downtime because you have skin that's unaffected on both sides. So it's going to heal from the bottom up and the outside in. But that's really good for fine lines and wrinkles and evening out some skin texture. And obviously it's something that you can do as like a stack treatment when you do something else over the top, like a micro laser, which is more like mowing the lawn. So, there's just
It's
different.
good. The yard references are probably helpful
Yeah.
for men.
Really helps the men. They can picture it all. So yeah. So it's nice to know that what it's doing, how it's operating, like what it's going to do for your skin long term. Collagen's plumping those fine lines and wrinkles. So yeah.
Great. That's helpful. Thank you.
You're welcome.
What do you do around facial hair when you're doing these lasers?
Facial hair, if you're doing a BBL, we always say BBL, it can like cinch the hair. Doesn't smell great. So that's why we typically would tell a man to shave the beard if you're okay with that, if you want that skin to be treated. But otherwise, we'll treat around the area. But if it's shaved, great. We'll treat over the whole area. I'm
Okay.
trying to think. Yeah.
And average downtime for some of these?
4 to 7 days for a bigger
Yeah.
laser. If you're doing like a skin pin, that's a minimal downtime.
Yeah.
You get some dry, flaky skin.
But like a week, they look maybe a little sunburnt, but
Yeah.
slightly.
Yeah.
Yeah.
And maybe even less, depending on how aggressive we have to be with a treatment. That's what's kind of nice is for everyone, it's all customizable. We can customize
Sure.
the settings on anything we do so that not only is it giving the patient the best outcome, but if we're talking about being comfortable too, we can adjust those accordingly.
Got it.
Yeah.
Nice.
Yeah.
Nice. What is a common sort of skincare regimen you recommend when a man comes in to see you for maybe some rejuvenation, but overall good maintenance?
Keeping it simple for men. They don't want the 10 steps that us women have come accustomed to, whether it's our skin or our hair or anything. So, a simple cleanser, maybe even a cleanser that has some exfoliants in it. A cleanser, if they have, hyperpigmentation, maybe a vitamin C that has hydroquinone in it. Obagi has a great C clarifying one that I like to recommend to guys. It can help lighten the hyperpigmentation while also being proactive and protecting the skin with those antioxidants. And then even something as simple as having a moisturizer with an SPF so they don't
Yeah.
have to apply 2 more products. It can just be one. I just try to keep it pretty simple and keep it basic. That way they're not overwhelmed and they just throw all those products out
Sure.
the door or hand them to their wife. So,
And are men more cost conscious when it comes to skincare products than women, or is it a mixed either way?
I don't know if it's cost conscious as much as it's sticker shock.
Yeah.
We're used to spending money, and I say this I don't spend too much on stuff.
Right.
Don't tell my husband. Don't spend anything. I would say that it's more so sticker shock. Like, oh gosh, a vitamin C that costs over $100.
Right.
I'm used to
Yeah.
using Dove
Yeah.
body wash on my hair and
Shampoo
face.
on
Like,
my face.
like,
Yeah.
shampoo on my face. Like, no, cut that out real fast.
Yeah.
So it's more so sticker shock. But I think when they realize what it's doing for their skin or they're seeing the benefits or their wife's doing it or their buddy is also doing it, they see that it's worth the investment.
Sure.
Yeah.
Yeah. Makes sense.
Yeah.
Good. Rachel, do you have any questions for Ashley about?
What do you think you do the most, like treatment? What would you say is the biggest one you do with guys?
Guys, I'd probably say BBL, broadband light treatment, just because of that, addressing the browns in their skin, as well as I can't tell you how many men come in and my wife has noticed this little red line here. It's a broken capillary, which it sees reds and browns in the skin, so it's a perfect one. So I'd say BBLs is we do a lot of BBLs.
Do you feel like you do that more than just regular facials on?
I do. Yeah,
Nice.
for sure.
And that's a pretty low downtime, right?
There's really no downtime. You can walk out and go to an
You're like
event.
slightly sun-kissed.
If some people, depending on what treatment you're in or what you're addressing, but you can go out and do your normal routine when you leave here.
Yeah.
Put on makeup, put on sunscreen, whatever the case may be. The only thing is that we say probably don't work out for 24 to 48 hours because if we are trying to collapse those little broken vessels, we want time for them to just slowly close on their own
Makes sense.
versus like having some blood rush back through them.
Yeah.
Yeah, we don't want that.
Makes sense.
Yeah. That's a good question.
Right. Should we move on to injectables in men?
Sure.
Okay. I also have personal experience in this. So, Rachel, what do you see men for injectables?
I feel like the biggest one is just the tried and true, like Botox.
Yes.
I think I definitely see that the most with guys and what they're
Yes.
looking for. And they're looking for softening more than they're looking for freezing. Where I feel like the younger women that I see want to see no movement, no lines. I feel like guys just want to soften.
Yeah. Makes sense. And those statistics I brought up at the beginning, they do show an increase in Botox in men as well. It's still a small percentage of all, but it's continuing to grow slightly, which speaks to your experience. You're treating the same areas, right? Men and women for Botox?
Yes.
Okay.
I feel like with women, you have to worry more about dropping their brows. Where with men, I don't worry about it as much just because they're lower set already.
Sure.
Um,
And
so
some
there's
would say a
different
lower brow in a
techniques.
male is almost attractive.
Yes, yes. And
Congrats.
I hear lots of women say that crow's feet are attractive on men. We're like
Yeah.
women, we're like,
Yeah.
I feel old
Yeah.
with this. For us, we're like, oh, that's kind of cute on my husband.
Yeah,
He's got some crow's feet.
absolutely.
So it's kind of weird. So you don't want to take them away.
What's the silver fox
Yeah, yeah. The salt and pepper
persona,
too.
right?
Yeah.
Yeah.
Yeah. We love it. We love a guy aging.
That's funny. Women don't get those graces all the time,
No.
unfortunately.
No. Mm-mm.
So what about filler for men?
I don't see it as much, but I have seen a little bit of an uptake this year.
Yeah.
And I feel like I was surprised. I had a couple cheeks this year. I feel like most of the time with men, it's going to be jawline. And I have had some elderly men care about their marionette lines more.
Oh, interesting.
So just sharpening the jawline for a younger guy or the heaviness as we age. Marionette lines start to develop. And
Where are those for our listeners?
right here in the corners of your mouth.
Yeah. Yes.
So these are the lines and just sharpening that jawline for guys. Yeah.
Have you seen many for like overall facial revolumization from top to bottom? Or
No, I do think that's a harder.
yeah.
I think the last
Men need
couple-
more of everything. They need more
Yes.
Botox. They'll need more filler. So.
Yes. And I do feel like the last couple of men I've seen, they probably could have used several series of Sculptra or filler, but I think that sticker shot really does hit them stronger. And I don't know if it's because we do the hair and the nails and the other upkeep already that we're like, "Ah, it's like my Amazon shopping cart. It's fine." Where they're more a little hesitant to do those things for themselves. But it's a slower burn. I think they need to think about it longer.
Sure.
And I don't think they're opposed to it. I just think they
Yeah.
have to get to the point where they realize the goal they're looking for is going to take a little more time and effort and money
Yeah.
and product.
When I was thinking about getting sculpture in my temples for years before I finally pulled the trigger.
Oh, really?
Yeah, yeah.
Yeah.
But it was like I keep seeing that in the mirror, and it's like I know I can do something about that.
Now
And
we
I
just
have
need
several great
sessions.
professionals who would be willing to stick some sculpture in my
Yeah,
face.
and not
So-
bad, right?
No.
It
No.
looks really good.
Thank you.
You're
Yeah.
welcome.
Well,
Great
I might
work.
need a couple more, so we'll
Yes,
see.
maybe another session or two.
Yeah, yeah. But it is nice to know that you can sort of make a little adjustment here and there.
Yes. And you don't have to go big or go home. That's not
No.
what we want in the injectable world
Right.
at all. It's a slow burn.
Yeah. Well, and it's gonna be a subtle movement of the needle.
Yes.
But yeah, okay, that's exciting. Can you break down the concept of masculinization versus feminization with injectables?
Yeah. So
How do you think through that?
I know. Well, I always think with women, we want a lifted high cheekbone and kind of our chin to come to a point. So kind of this upside down triangle shape. And men tend to do the opposite. So their jawline is their widest point. So when some women come in and they want a snatched jawline, and we can do that, but you have to be careful not to widen it so it doesn't look masculine. And same with men, like we don't want to give these plump, high cheekbones. So it's kind of just a balance of like remembering proportions. Thank you.
Yeah, that was a great answer. That was a tough question. Ashley, do you have any questions for Rachel that you're thinking about? Injectables for men?
I don't know. What do you think's a great starting? I know you said Botox is the most common. My husband, hopefully he doesn't listen, but he probably will. He's approaching 40.
Yeah.
I mean, would you recommend starting Botox at a certain age for a guy or a certain area or Sculptra like Dr. Spaniol had said?
For Botox, I don't really put an age on it. I think a lot of people in the industry don't either. I think when you start seeing static lines appear, so the lines that are there even at rest, so from your movement over time, it's kind of creating an etched in line. Anytime that's starting, I think it's a good idea to start. You can always start down the road later. You're in a little bit more of a corrective than preventative, but I don't think 40 is like too late or too soon. I think that's a good age. My husband's also 40 and I would love to poke him with some needles. I don't think I'll get him, but
Surprise him with a Monarch gift.
yeah,
card.
but I do think just treating, because I think they're a little more hesitant. Like a woman, I think you could go in and be like, I think you could use it here, 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 and here.
Right.
I think to say that to a man's a little off-putting. So sometimes it's like, I think we're just going to start on your crow's feet. In 2 weeks, you can come back. We can see if we need to touch up. Or at 2 weeks, if you want to add a little more, you're like, okay, this wasn't so bad. We can do that.
Right.
Or plain in 3 months, come back and we'll add some places.
Okay.
But I typically go over still like what your total units would be, what that cost. And if they look a little scared, then you just kind of, okay, you are not forced to do this. You want to do this still? Correct. Okay, we're on the same page. And then maybe we just start with crow's feet or glabella.
Right.
That's probably where I would start in a guy if he was hesitant to do anything. And then I think they're a little more like, okay, this isn't so bad. I still look like me.
An average crow's feet in a man, how many units? Around.
Yeah, I would say like I'd probably do the 12 and 12 for most. So like 24 units.
Yeah.
Most guys are that way.
Pretty reasonable.
It is.
Price tag to start with.
It is. Yeah.
What was I going to say? Interesting study was on twins in Italy with Botox, and they started in their 20s and they did preventative in like the areas where they started to have some dynamic wrinkles. And then the twin that they didn't treat obviously had more wrinkles later and needed more Botox later. So there is some value to starting on the slightly earlier side before those wrinkles get deep and set.
Yeah.
And then do you think people who do preventive need less if they go regularly?
I do. I
similar with filler too, right? You don't deflate completely.
Right. You always hold on to a little bit.
Yeah.
Yeah. But I think anytime you're unable to make that full movement, if you're not able to let that wrinkle form and get worse. So I would always say, I know I hear a lot of people make fun of 20-year-olds and 30-year-olds for getting tox because they're not old enough yet. They don't have wrinkles, but you're like, but they're not going to either then, you know? So I don't think there's anything wrong in starting young as long as you have that strong muscle movement.
I'll be the first to admit I started at 24. I wanted to be proactive
and gorge.
Yeah. So sweet.
Look at you now. You're 26.
You know
don't
what?
look a day past 25.
I'm actually almost 25. No, I started at 24. I had a friend who she worked in a med spa, and she's like, Ashley, if you want to be preventative and prevent wrinkles, I was like, you know what? I'm going to start. And I've never had lines unless like I'm pregnant or something and not getting any Botox. But other than that,
yeah, it's wonderful.
Give me the Botox is wherever I need it.
Wonderful. Wonderful treatment.
Nice.
Yeah.
Yes.
Yeah,
so
good.
I started young, and I think I would agree.
I feel like I was late on the game, not late,
Yeah.
but I'd say early to mid 30s I started, and that feels late in the game now, but now I'm like, there's really not a late and early,
Never.
but I do think the earlier you can start preventative treatments of any kind, the better.
Right.
Yeah, and I think men are worried about becoming frozen because everyone knows about that phenomenon.
Or Spock brow.
Yes.
They always think
Yes.
of worst case celebrity.
Yeah, and we in my plastic surgery fellowship, we had Botox clinics, and we would use the extra on each other when the clinic was over. And I've had my forehead frozen, and so I know what I don't want.
Right.
But I also know that's the result of like learning. Not going to an experienced injector.
Yes.
So.
It's very true.
Anyway, it should be a rarity if you're going to someone who's well trained.
And I think that's something in general people don't give enough grace to. All of us notice what's bad.
Yes.
Right? Like you can notice someone's bad pigmentation, bad surgery,
facelift,
bad injectables. But we're walking around tons of people every day who do all these things that we have no idea because it's done so well. And that's way more the norm than, the bad. I just think the bad sticks out in everyone's head that they're like, I know I don't want that. So.
Yeah.
We got some questions for you, Dr.
Okay.
Spaniol. You ready?
Oh gosh, now that we're all warmed up, I guess I'll go last.
What would you say some surgical treatments are that you're seeing more men pursue today? And why?
That's a good question, and it's kind of hard to answer because men are increasing in their demand of cosmetic surgery things, but in the 2024 statistics, it's 1%. I mean, I've been in practice for 4 years and some change, so I'm not seeing much of a change myself. I definitely saw the change during COVID when I was in training, But I do think, like I said at the beginning, that there's more momentum now. Men are more aware. And so I think that the ones that are coming in are moving forward more often. But like you said, slow burn. They've been thinking about it for a long, long time. Um, the surgical treatments that we're seeing more of now are kind of just all of the things that men would get: liposuction, eyelid surgery, gynecomastia. They're just 1% more than they were a year or two before.
Yeah.
Um, but usually when I've consulted with men, it's usually like, this has bothered me since I was a teenager, if it's gynecomastia or
Right.
we are seeing more of the weight loss after the GLP-1 medications. And so those are men who they're like, this is driving me crazy, this extra skin down here. And just like women too, I think they're doing it for themselves.
Right.
I think some of the public thinks that people pressure each other into getting breast augs and tummy tucks. And I don't really see that in my patients. People that are doing this are doing it for themselves, men and women. And so that's definitely a trend that I've noticed. There's not like one procedure that's really hot for men right now. Like it's all just a slow burn. It's 1% brighter than it was last year.
Would you say that a lot of those people are, spouses of someone who's had a cosmetic procedure, or
Yeah.
are they just someone who's, like you said, something
Yeah.
that they thought about for a long time?
That's a good question too. Some of it are, men of women who've had, mommy makeovers, and they see how happy their wives are and how great they look.
Absolutely.
And they're like, gosh, she looks amazing. I should try it. She set the bar pretty high. Let's see what I can do,
Yeah.
So there's a little bit of that. But it's still, they're doing it for themselves because they want to match the person who they love. So that's really neat.
Cool.
Yeah.
Okay, so we talked about with injections, men and women, and how, structurally the differences. Do you feel like you use different techniques or anything, or you're planning your techniques for men versus women?
Sure. So yeah, for the face, you highlighted the key structural differences, like the heart-shaped face in women versus more of a square-shaped in male. Definitely in a male, eyelid or facelift procedure, you definitely want to keep in mind, feminine versus masculine characteristics as far as facelifting, where you're gonna land your jawline, if you're facial fat grafting, where you're gonna put the fat and things like that. But it's keeping the same aesthetics in mind for the face. For abdomen, men often don't care as much about, fixing the diastasis, getting a snatched waist. So if I'm talking about a tummy tuck or an abdominoplasty, in a female, I'll overcorrect that diastasis to give them more of an hourglass figure. In men, maybe just correct it back to 0 if they've lost a bunch of weight and they have some diastasis. Another option for men, if they really just want the skin removed, they don't care that they have kind of a central diastasis or a bulge, is you don't have to correct it. So I talk about both of that with men. Whereas with women, I pretty much universally always at least correct, if not overcorrect, the diastasis. That's the biggest difference in abdominal. Men also, may leave off liposuction of the waist, again, because they're not seeking that hourglass.
Figure,
If they're just going after skin and they're like, they want less downtime, they want to spend less money on anesthesia and everything and surgical fees, then we can sort of leave some things off based on their goals. So, yeah. I kind of skipped chest procedures, but those are we could have a whole podcast on male versus female
Yeah.
breast and chest differences in surgical techniques, because they're completely different surgeries.
How common or popular are procedures such as gynecomastia surgery or liposuction for men?
They are pretty rare overall, overall percentages, but they're consistent and they're making slow gains every year, a little bit, 1% of the total procedures at a time. But like I said, the men that are coming in for them they've been thinking about it for a while,
Right.
Yeah.
and they're usually super happy.
They love the results.
They're so excited because you can usually show them usually if they're coming in and the things their concern is bad enough that they're willing to go through surgery, then if you can fix that thing that is so bad for them, they're super grateful.
That's awesome. Do you find that there's a stigma associated with any of those procedures?
I don't really appreciate that. I think men just have different priorities than women. So they're coming in less often, but when they do, and they've got a problem that they see that's a really big one, and they move forward with surgery, that's usually worth it.
I've seen patients on that side before, and I always, when it was gynecomastia, I feel like, you tell me, do you feel like guys come in and they're really like shy to talk about it with you? Or do you feel like, hey, I'm ready to talk to a surgeon about this? Because like you said, it's an issue that they've had since maybe childhood, and it's something that's always bothered them. So is it easy for them to open up to you in kind of a vulnerable situation or talking about something like that?
There's kind of two patient populations for those. There's the ones in their teens that come in with a parent, and those ones are often very shy. And they're like, they don't even want to get undressed or anything to talk about options and surgeries. Usually the parent is the one that's like, this is driving him crazy. He's getting teased. Please, I really want this. I really want to help my child. Kind of thing. And then the other patient population is the male in his 30s who's like, this has bothered him since he was a teen, and he's like, finally I'm going to do something for myself.
Right.
And both of those populations of patients are super grateful when you can, bring them across the finish line.
Absolutely.
Yeah. They're not the ones that are putting Google reviews out for you. They're usually not the ones signing photo releases either to put on the website.
But they're in the room like, look what I did.
So,
but they feel
which can make it it can make
Yeah.
it sort of a hard sell when you see another one, because you like, I promise I've done more than one of these.
Yeah.
Absolutely.
I only got one picture on my website, but he was really happy. So.
I'm sure.
I can attest to that.
Whereas women are like, yeah, please.
Yeah. Well, I just feel like for guys, especially too, you think of them like, I had brothers, like growing up, their shirts are coming off. So it's like, I'm that one that's like, oh, I feel so bad. Like, I wish more young kids and men felt comfortable doing stuff to themselves to make them feel better about themselves. So, yeah.
And it's the gynecomastia surgeries are really good. They're a very gratifying surgery for the patient.
And it's minimal downtime. It's an easy procedure probably in general. So,
what about liposuction? Do you feel like there's much stigma about men coming in for liposuction?
I don't really think so. I think, it's similar. The ones that go through with it are so adamant about having it done and making this change that they're glad to go through it. And I don't know. Yeah.
I just would love to see more guys doing things for themselves. Yeah. And how we like break that barrier.
Yeah.
I would too.
We come in and we're like, take my money.
I know. Can we add on?
So for guys, I guess
some guys are like, gosh, I could get that, whatever. Yeah. That ATV or that new thing.
Yeah. That's true.
Yeah. That's true.
So, I don't know.
Or go on that guy's trip. So.
So there's different priorities.
What about for recovery? Is it different for men versus women in recovery or in complications?
I think so, yes. So for facelifts, men definitely bleed more, and that's been shown in studies. Many surgeons will more likely keep a man overnight and let him go home the next day to make sure blood pressure is controlled, to minimize bleeding and stuff. Surgeons who do facelifts on men may more likely leave a drain. I would certainly more likely leave a drain in a male for several reasons. It does decrease some bruising and swelling, but it's also kind of a leash, and it helps slow them down.
Yeah.
For gynecomastia even. Yeah. So I'll leave the drain for at least a week, because it's a reminder to like, don't be a dumbass,
Yeah.
And same with compression too. So I'll make them wear compression longer, because they're more likely going to push the limit of what I tell them to do.
Yeah.
And I think men are more likely to bleed after like a gynecomastia surgery too than an equivalent procedure in a woman, just based on physiology. But there's definitely some behavioral characteristics that add to that. So definitely post-op as a surgeon, you're definitely going to slow yourself down and think more cognizantly about that specific patient. I'll ask them, what do you do? Like, do you work out? What do you do? What do you do for work? Because if they're going to be throwing boxes at work in 2 days if you don't really
Yeah.
put a leash on.
Absolutely.
Like,
Absolutely.
that's right.
Yeah. Yeah.
Oh man.
I just think to the guys, like, I know, and I'm like, no, you're right. They would, like, the second they could
Yeah.
go back to work and overdo it, they
Oh,
would.
yeah.
Well, I'll tell them,
My dad
your
would
heart
walk
rate.
out of here with a stitch, like not even, Mom, help me, I gotta get to work.
Yeah.
Yeah, I'll tell them if you get your heart or blood pressure up, and sometimes you have to give them parameters. Like you may not get your heart rate above 90, or if they have a heart rate. Most, a lot of the smartwatches do heart rate.
I hope they have a heart rate.
1 week, you can. No, I mean on their watch. Yes, the patients. Yes, hopefully they still have a heart rate. Oh my gosh.
He's pointing to his. I was like, I'm glad he's pointing to his.
It's like you can go to the gym and walk on the treadmill, but you need to keep your heart rate below 90.
Shoot.
You know what I mean? It's like
Yeah.
that kind of stuff.
That's a rough one to do. They're probably like, yeah, I'll stay off
Yeah,
that
I'll just
treadmill
stay at
for a few
home.
days.
Yeah.
And I'll tell them, like, you could bleed. You may have to go back to the OR. Like, tell them all
Yeah.
the things that could go wrong if
Scare
they don't
'em,
listen
scare
a
'em.
little bit.
Scare
Yeah.
tactics.
Sure.
Yeah.
Oh gosh.
Whereas women will get online, they'll be like, oh, I read that if I, get this warm massaging, this blanket that goes on my legs after my thigh lift and I lay back, it'll massage my legs. And then they do that and they come in at 1 week. And I saw this lady, I was like, you look amazing. Like, I don't know what you're doing. Don't tell anyone because you're way ahead of the curve. It's because you're like so invested
Yeah.
in doing everything right. You're going to go out and do more than what I tell you.
Yep.
Yeah, that's true too.
Why is that with guys versus girls? Why do the girls always stick to the plan and guys who are like, reel it back in, buddy? Because do you have guys that are like, I need to go work out after my injections? And you're like, "That's-"
100%.
yeah.
I'm married to a guy like that.
Yeah.
Yeah. He had a procedure done, and before we even left, he's like, I think I can go to work. Yeah, no.
You can't.
I think it's illegal. But yeah, I think there's always, I don't know.
Because I know for injections, like you tell people, no, what, working out for.
24, I just say 24 hours, 24 or 48 hours.
Yeah.
Yeah. And I'm sure they do.
Yeah.
And I'm sure they do.
I don't have a good answer for that either.
Yeah.
I don't know.
What could go wrong?
Yeah. Let's test it out.
Yeah.
Dr.
Better
Span-
test out with me than you, though.
Yeah. Dr. Spaniol, I have a question. What would you say is your favorite procedure to do in general when it comes to men?
I think upper blepharoplasty is it's simple, it's straightforward. So many men have a little bit of extra upper eyelid skin. It's a very low downtime procedure done in the office. And it's like when you're conversing with someone, 60 or 70% of your time is spent looking at the eyes or the nose, that area. And it's just such a high value procedure, I feel like, for what you pay for what you get. I think that's a great one. It's almost like Botox for crow's feet. I feel like it's a great,
Yeah.
you see a nice benefit and improvement, not a lot of investment, minimal downtime, no leashes.
Yeah.
Is that a big change in the yeah.
Correct.
Yeah.
I think that's a great one that
Because I feel like I can notice a big difference, obviously, on guys that have had it, and they're so happy that they did it. And not only do they look more youthful, but they're like, I feel like I can see better, like
100%.
their peripheral or whatever the case may be. That truly it's an instant change for them.
Yeah.
It takes years off of them.
And that one is one that is very much not taboo, I feel like, with men as well.
Yeah.
Particularly older men. They'll say, they'll tell their friends and how happy they are. And
Right. Do you see that men do upper and lower blephs, or is it mostly they start with an upper and then sometimes they convert to wanting to do lower blephs as well?
some, but it's not as much as you would think.
Yeah.
Because some would see a huge benefit from a lower, and the upper's not that bad, and they do the upper, and then they're done.
Yeah.
And you're like, oh man,
Only.
if only.
Yeah.
Yeah. So it's not as much as you would think,
Right.
in my experience. But we're talking, a small number of patients here.
Yeah.
Good question. Yeah. What about you? What's a good procedure, Ashley, that a great one for men to start with?
BBL.
Yeah.
I mean, it's just, there's no downtime. It's a very quick procedure. the BBL Hero that we do now versus the BBL, standard BBL, they're both great. It's not as painful. It's a quicker procedure. It's 4 times the speed, 3 times the power, and 2 times the coolant. So
For Hero versus regular.
for Hero versus regular. So you can go quicker, and the snap isn't as snappy. Where it feels like a hot rubber band snap with a regular BBL, you can do it a lot quicker, and you don't feel that as much because of those other factors.
So how did they change the technology to accomplish all those things?
Well, I don't know. According to a physicist, no.
Yeah.
I honestly don't know. Sciton comes out with some of the most incredible technology. But I mean, I push most people these days to do a BBL Hero because you're getting more skin tightening with it. It's just the latest advancement in technology, or the ones that we carry. So I think a BBL Hero is just, it's so quick. It's so beneficial to the skin. There's actually a Stanford study on BBLs where they did them on patients for a 10-year time period. Over those 10 years, they had patients come in quarterly, and at the end of the 10 years, they biopsied their skin compared to the skin that they had biopsied 10 years prior. And the new skin, which is 10 years older, actually responded younger under the microscope than it did 10 years prior. So that's when they discovered that BBLs make the DNA of the skin think younger. So I tell people it's one of those procedures you can do to be proactive, but as well reactive. So you can address the browns, you can address the reds, you can induce collagen, but with the Hero, you're getting more skin tightening. So do that one and not the other one.
Love it.
Yeah.
That's great.
Good stuff. Yeah.
Yeah.
And the nice thing about it is you can do it on the face, you can do it on the hands,
Mm.
you can do it just about anywhere on the body. So, yeah, great stuff.
Great.
Yeah.
Rachel, you said crow's feet was a great one for men to
Yeah,
start with.
I'd say crow's feet or between the brows, the glabella or 11s, the angry lines. It's a good one to start.
Yeah.
Perfect. All right. Great. Well, thank you for joining us for another episode of The Aesthetic Angle presented by Monarch Plastic Surgery. Have a good afternoon, evening, day, night, wherever you are. See you next time.